Good afternoon, and thank you for joining us today as we give you the update on the COVID-19 pandemic here in Erie County. Today, we have 31 new cases to report and 2 additional deaths. In the past week, since last Wednesday, we've had 273 new cases of COVID-19 and 3 additional deaths, unfortunately. The positivity rate in Erie County was 6.4% for March 26th through April 1st, according to the Pennsylvania Department of Health. I continue to offer a word of caution to everyone. The virus is still very present here in Erie County and also always looking for its next host. The variant is also present here in Erie County. So please continue to follow the guidelines that we've been talking about for a year now. And when you are eligible, I encourage you to go and get vaccinated. And if you've had 1 dose, get your 2nd dose of vaccine. There are a lot of myths surrounding the COVID-19 vaccine, so it is important to follow reliable sources for your information. Sources such as the CDC, the Center for Disease Control, the Pennsylvania Department of Health, Johns Hopkins has a great site to follow, and others. Remember that the vaccines have been tested on tens of thousands of people and on a diverse range of people. And of course, millions of doses of vaccine have already been administered with very few side effects. These vaccines are safe and effective, and they are critical for the survival of so many in our community and critical for us finding a way to get our lives back to some sort of semblance of normal. None of the vaccines authorized for use in the United States contains any live virus. So don't get the vaccine just for you. Get it for your grandmother, for your coworkers, for your children. If you understand how to use a computer and others in your family don't, help those grandparents or parents to sign up for a vaccine or offer to give them a ride to the vaccination clinic. Make it easy for your loved ones who may have some barriers to get the vaccine. Again, I encourage you to get the vaccine when it is your turn. Don't we all want to get our lives back to normal? Getting vaccinated will take us closer to that day. And the vaccine is absolutely free for all of us. As of now, approximately 1/3 of all eligible in Erie County have been either partially or fully vaccinated. And that, to me, is really great news and something that we should all be very proud of. So all involved, all getting your vaccine, please keep up the good work. There is a mass vaccination clinic opportunity to receive the J&J vaccine for all residents of Northwest Pennsylvania. And I know that there's a number of people who said they've been waiting for the opportunity to get the J&J vaccine. The clinic is being held at the Cranberry Mall in Venango County, and it's from 8 a.m. to 4 p.m. on most days. And of course, an appointment is needed. And you can sign up at vaccine.upmc.com, or you can call the Venango County Vaccine Helpline at 814-432-9667. So that's vaccine.upmc.com or 814-432-9667. And again, this is a vaccine clinic for all residents of Northwest Pennsylvania. If you have limited access to online services, you can always call 844-UPMC-VAC. That's UPMC-VAC between 8 a.m. and 5 p.m., 7 days a week. If you do not have direct support professional that can provide you with the COVID-19 vaccine and a healthcare provider information, you can always call the Pennsylvania Health Hotline Lots of numbers today. This one is 877-724-3253. That's again the Pennsylvania Health Hotline at 877-724-3258. And now to share more information about vaccine and just a number of issues around COVID-19, I'm always happy to have with me Charlotte Behringer, the Director of Community Health Services at the Erie County Department of Health. Char?
Yes, good afternoon. Thank you, County Executive. Today I'm going to talk about three topics. The updated cleaning guidelines that came out from the CDC this week, and a couple brief comments on vaccines and testing. So first of all, cleaning. I think that we've had some information out this week about the CDC came out with updated cleaning information. We know that the virus that causes COVID-19 can land on surfaces, and it's possible for people to become infected if they touch those surfaces and then quickly touch their nose, their mouth, or their eyes. What we now know is that in most situations, the risk of infection from touching a surface is low. The most reliable way to prevent infection from surfaces is to regularly wash our hands or use hand sanitizer. Cleaning with routine cleaning products will kill the virus that causes COVID-19 disease. Disinfecting using an appropriate substance approved by the EPA will kill any remaining germs on surfaces, and it further reduces risk of spreading any kind of infection. In most situations, cleaning surfaces using soap or detergent and not disinfecting is enough to reduce the risk of spreading disease. Disinfection is recommended in indoor community settings where there has been a suspected or confirmed case of COVID-19 within the last 24 hours. With this in mind, translating this to simple ideas. In our homes, we don't have to go nuts cleaning. Unless we have somebody in our home who actually has COVID disease, then we're going to want to be more thorough. But in facilities should continue to either clean more frequently or disinfect in addition to cleaning in shared spaces, because we know that Erie County currently has a high incidence of disease, and a facility will not know if someone was in their facility with COVID disease, as we know that about 40% of the people with COVID disease do not have any symptoms. We also know that the risk of spreading disease from objects or other materials can be reduced by wearing masks consistently and correctly, practicing hand hygiene, cleaning, and practicing social distancing in facilities. Cleaning guidance does lean towards being conservative. As we have more understanding about the virus and how COVID disease spreads, guidance will be updated. Now, vaccine. As the county executive stated, most COVID vaccines currently in use do require 2 doses. It's really important to receive that second dose to obtain the highest level of protection that's possible. A person is considered fully immunized 2 weeks after their second dose, or if it is a 1-dose vaccine, 2 weeks after that dose. As far as COVID testing goes, we're coming into the allergy season, which for some people means increased nasal congestion. We know that increased nasal congestion is also a symptom of COVID disease. I really encourage you to err on the side of caution and obtain a COVID test rather than write off that symptom as it is just my allergies. And that's my update for today. Thank you, County Executive.
Thank you, Char. We appreciate all that you and the entire staff at the Erie County Department of Health do to preserve, promote, and to protect the health, safety, and well-being of the people and the environment of Erie County. Because this is National Public Health Week, I invite everyone watching, tuning in, listening, to send a note of thanks to our health department. You can do that easily through an email at ecdhinfo, I-N-F-O, at eriecountypa.gov. That's ecdhinfo at eriecountypa.gov. Or you can send an old-fashioned note through snail mail, and you can do that to 606 West 2nd Street, Erie, 16507. And we would all want to say thank you to our health workers, our public health workers who truthfully have been working long days for far over a year now to keep our community as safe as possible. They've done a phenomenal job, and I think here, as we celebrate National Public Health Week, is the perfect opportunity to recognize them for their extraordinary efforts over this past year. We're highlighting the health department work along with the work and programs of all of county government during this month of National County Government Month. And you can see more on that at eriecountypa.gov and on all our social media channels. Last Monday, the Emergency Rental Assistance Program was launched, and in just 1 week, we've had 330 applications completed and 510 are in process. So obviously, a lot of need out there for people to get assistance with paying their rent, paying those utility bills that they've not been able to do because of the effects of COVID-19 pandemic. All are encouraged to apply, but those with the lowest income and the greatest need who meet the eligibility requirements are given priority. You can find more, again, at eriecountypa.gov. Our website truly has so much information on it, so I hope that you're getting on there frequently, checking out all the information on there. And now we're going to turn to our media for questions, and today we're going to start with Jet TV. Jet TV, are you with us?
Sorry, I had to unmute it. Yeah, this is Brian with Jet 24. Could you just reiterate a little bit, County Executive? You mentioned a lot of people, there's a lot of myths out there. They don't believe that, the vaccine is actually as effective and as helpful as it could be, correct?
That's what we're hearing. There are some people who think that if they had COVID, they don't need to get a vaccine. Well, that's not true. The protection you get from a vaccine is found to be much greater than it is if you just had the disease. So we recommend that people who've had COVID-19 go and get the vaccine also. And some of the other myths I mentioned, that some people are just concerned that somehow they're getting the live virus. I've even heard concerns that somehow it's going to change your DNA, which it does not. So go to those trusted websites of the CDC, the Pennsylvania Department of Health, some of our big medical providers. You could go to Johns Hopkins and really do your research. And I think you'll see that it is really a safe vaccine and something we need to encourage everyone to get.
Thank you, County Executive.
Sure. Erie Times News. David, are you with us?
Yes, I am, Kathy. Thank you. What have you and Shar been hearing from the vaccine providers about the demand for vaccine slots under Phase 1B, and how does it compare with the overwhelming demand there was in the early part of Phase 1A? I'm hearing the demand isn't quite as strong. What are you guys hearing?
Well, I am hearing that also in terms of, I think there was a number of people that would be in 1B that maybe had some underlying condition that put them into 1A and they already got their vaccine. So there is that piece of that. But I'm going to see if Shar has any additional information about the actual demand at this point for those who are doing the vaccinating.
Okay. Thank you. Yes, we have actually heard the same thing, that there is demand, but it's not the overwhelming flood and people frantically trying to find a vaccine appointment that we experienced earlier on. So there is demand, but not overwhelming, frustrating demand as there was earlier, is what we are hearing.
Is there a concern, either Shar or Kathy, is there a concern on either of your parts because the demand isn't so strong? While it's nice that people aren't frustrated right now, but is there a concern that the demand is going to peter out entirely well before we get to 60 or 70% of the eligible population getting vaccinated?
Shar, you want to go first?
Sure. I'm really not concerned about that. We're still in a phased approach. There are certain groups of people that are in this week's phase, and if people are being respectful of those phases, it really should not be overwhelming at this point. When we get to April 19th and it's open to everybody, then we'll see what happens.
Thank you, Shar. And I was going to just reiterate basically what Shar said, that we still have 1C, and then, of course, opening up phase 2, which is open to everyone. And I think there's still a lot of people who are waiting for their phase to open up so that they can get the vaccine. We do know in phase 1B, for example, all the teachers were in there, and if the state, of course, came in and did the special clinic just for teachers and school staff. So that was a big chunk of 1B that actually got taken care of earlier. And I think that's why we're maybe not seeing quite the demand. But if you are in 1B or 1A, there are definitely vaccine out there available for you. So please sign up. You may even be able to get an appointment the same day. If not, maybe even the next day. Talk Erie, Joel.
Yes, good afternoon, County Executive. To follow up on David's question, according to state vaccine data, it seems that shots in the arm kind of peaked 3 weeks ago. And although we continue to vaccinate a lot of people here in Erie County, we're off that peak from mid-March. Can we anticipate a jump in vaccinations this week and in the coming weeks?
Again, I'm going to ask Shar to address that because she follows those numbers from the state much more closely. Shar?
Okay. I would not say that we're off of our peak, Joel. We have over 7,000 doses of vaccine over 7,000 doses of vaccine available in Erie County this week. And we are told that that supply will continue and will likely increase in another month or so.
So, Shar, as a follow-up, do you think that you'll be depleting all 7,000 doses? I mean, are we keeping up to that 90 percentile plus of what's been tranched out and what's going in arms?
We are certainly very close to it. It is a little bit of a challenge with no-shows for appointments. And what we're finding out is that people who have made multiple appointments but didn't cancel all the other appointments after they received the dose that they were seeking. But yes,
Thank you.
Again, we really are not going to be shift vaccine if we're not using what we have received. And we have been using what we have received, at least the required percentage.
Thanks so much.
And I want to reiterate the second dose is so important. That's the other thing we're hearing a lot about is people are not showing up for their appointment for the second dose. And then, of course, that opens it up for somebody to come in and get a first dose. But we need people to understand how important and imperative it is that they go get their second dose and come to their appointment that was scheduled for them. Thanks, Joel. Erie News Now.
Good afternoon. A question for Shar. Because we're not having the demand that we had several weeks ago, and because there's no way to actually verify if someone falls into Group 1B or 1C, at this point, is there an argument to be made to just open it up now to everybody, to increase demand, to make sure that you're getting as many shots in arms as you can? I realize it's a state decision, but at least in our area, could more doses be given than are being given right now if we were to open this up to everyone?
Well, as you stated, it is a state decision as far as when we open up. And because we are able to administer the huge majority of the vaccine that we are receiving, at this point, the phased approach seems very reasonable for Erie County.
So it's working well. We're now, we are getting the vast majority of into arms. We're not having appointments go empty or unfilled.
That is correct.
Thanks.
Thank you, Ethan. We'll go back to Brian at Jet TV.
I'm sorry, it's actually Chelsea. Everyone's been talking about on April 19th, the general public will be eligible for vaccinations. My question is, since that's less than 2 weeks away, what local vaccination efforts will be made? Will there be mass vaccination sites at local hospitals? What will be done for the general public?
So there's been planning on vaccine happening, for many, many, many months. And that keeps evolving, looking at new sites. Even this week, we're out in some of the more rural areas of Erie County, making sure that there's clinics out there so that people have less of a barrier to get that vaccine. And we'll continue looking at new sites, which we are. The team is currently looking at new sites and looking at different options, looking at does a drive-through vaccine clinic make sense now that the weather is getting better in Erie County? Of course, we have weather to deal with that they don't have in maybe the southern states when you've seen some of those big drive-through clinics. So we are continuing to look at different sites throughout the whole county, and also at maybe sites that look a little different than the ones where you get out of your car and walk in.
So as of today, there's no plan for a mass vaccination site for when the general public has access?
Well, again, I think it will depend on how things roll out. And Shar, I don't know if you have any further information on that. As I mentioned earlier, we do have this, what they're calling a mass vaccination clinic in Venango County that is for 9 counties of the Northwest with the J and J. That's being run by the state. Shar, do you have anything further on that?
And in actuality, the 3 large sites that are currently running between the Bayfront Convention Center, what UPMC is offering, and what Allegheny Health Network are offering are all considered mass sites because they're pushing through with 1,000 to 2,000 people a day.
Thank you.
Thank you.
Okay, David, Erie Times News.
Sure. Kathy, this question's for you. A couple months ago, the county had unveiled what some of its plans were going to be when it came time to help spur more demand for vaccine, when this rush was going to be over. What has the county enacted out of those plans to help draw more attention to the vaccines and to spur people, especially in the underserved areas, to get vaccinated?
Well, one of the things we've done is actually go to those communities and get the leaders in those communities to take a leadership role. And so there will be some vaccination clinics in, for example, the neighborhood centers. There already have been. There'll be one coming up at MLK here shortly. They've already had them at Booker T. Washington, and I believe Quality of Life even had one. So we've got vaccine clinics, again, going out to some of our more rural communities that haven't had that opportunity. And those are the type of things that we feel the trusted source is not always government. It's sometimes the person next door, your pastor, your, the community center where you go. And so we feel like this is a very good strategy. And our health equities team has been working directly with some of these trusted community leaders in these particular groupings.
And you also mentioned right off the start, you mentioned the myths as being a big concern about that. And have you heard about this directly, or have people reported back to you that these myths about the vaccine are a little bit more are stronger and a little bit more persistent than you thought they'd be?
I don't know that they're more persistent than we thought they'd be. We always knew there would be a percentage of people, well, we've known that for a long time, I should say, that there's a percentage of people who don't really believe that this virus is even real. We still have a few people like that. And we have others who believe it's not as dangerous as we know it is. We still have people who think if they've gotten COVID-19, they don't need the vaccine. So those are the kind of myths that I think we're going to have to continue to push back on and try to get the right information out there. How do you reach people? You reach them through the paper, the radio, the TV, through social media, and through the places they frequent, whether that be their church, their community center, etc. So you know better than almost anybody, people get their information from a myriad of ways these days. So we're trying to make sure we hit all those different channels and get to people with the right source. But for some people, they're going to hold on to their beliefs. And so I think what's important when we get people, even like the former president and our current president and other leaders all the way down to the local level talking about the vaccine, it's safe, I got it, get it. When we have people that they trust say that, I think that helps too. Thank you. Talk Erie, Joel.
Thank you.
Mm-hmm. Joel, are you with us? Talk Erie? All right. Maybe something happened there. We'll go on to Erie News now. We'll go back to Ethan.
Hi, another question for Shar. How concerned are you about the possibility of another surge here, specifically in Erie County? Our numbers are rising, but perhaps not as badly as the rest of the nation at the moment. But Pennsylvania is among the states with the most new infections each day. Where's your level of concern right now over the possibility of seeing another spike or another surge here?
Well, I am somewhat concerned. Comparing 2 weeks ago to this past week, we held steady. There was only a difference in 10 cases between those 2 weeks. We know last week when I reported out, we were up 32%. We know that the variants are out there. We know that they're going to increase. We know that a number of the variants have the ability to infect more people more easily than the virus when it first started out. So knowing that, combined with things are loosening up a bit, we're having more capacity in buildings. People can't get too relaxed yet. Even if you have vaccine, when you're out in public, you really still need to protect yourself, protect others around you, with that mask wearing, with that physical distancing, with keeping your hands clean.
Thank you. Joel, are you there from Talk Erie?
Can you hear me now? Can you hear me okay?
I can hear you now. Thank you.
Okay, thanks so much. This is a question for Shar, and I want to pivot about the summer festivals. There's been a lot of reporting about the summer festivals and the fundraising events and the difficulty in planning, considering that some of these organizations raise the majority of their yearly budget from these events. What is the health department's current guidance for these summer events as they try to plan?
Okay, actually, through our environmental division, they have worked very hard in communicating out to these organizations through the use of they have designed an event checklist, which basically gives an organization guidance on the safest practices that they can have if they're going to hold an event. So they're providing the organizations with the information, and it's going to be up to the organizations whether or not they're going to hold the events that they hope to hold. But our environmental division has spoken with the chamber, with the nonprofit association, with other business groups, and is widely disseminating that information to the organizations that would potentially be holding these events. Thank you.
Sure, just a follow-up. Are you aware of any incidents where the environmental division has had to put a denial of a health and safety plan that as presented to them by a festival or an event?
We are generally not denying events, but we are giving them guidance as to the level of risk that that is being taken if the event occurs. Now, it's up to that organization to decide if it's worth that level of risk to our community.
Thank you. Thanks, Joel. We're going to go back for a final question from Brian, or I guess it's Chelsea now at Jet TV.
No, it's back to Brian.
Okay. You guys have me hopping today.
Right. And I guess just to reiterate what you kind of just mentioned, I know Discover Presque Isle is going to be happening again this year, but in limited form. So did they reach out to you? Was there guidance? Did you give guidance to them of what they can and cannot have, obviously?
I'm not sure on the specific groups that have been working with our environmental division, because obviously there's been many of them. But I will ask Shar if she has any specific information on Discover Presque Isle.
I do not have specific information, but knowing the close relationship that our environmental division has with Presque Isle, I feel fairly confident in saying that they have spoken with our environmental division.
Thank you.
Okay. Thank you. David, do you have a last question from the Erie Times News?
Yes, Kathy, thank you. And this is for Shar. Shar, we had talked yesterday about the hospitalizations, the fact that they've continued to go down while cases have gone up the last couple of weeks. Today, at least from the State Health Department's dashboard, it's gone down to only 6 county residents being hospitalized, the lowest level we've seen, I think, in 4.5 months, the lowest level for a day in 4.5 months. Is this an aberration? Again, I know you don't want to look into your crystal ball, but what does it speak about the fact that we see so few hospitalizations today due to COVID?
It's certainly encouraging. But at the same time, we know that there have been significant hospitalizations in persons less than 65 and persons less than 55. So with that in mind, I'm not going to draw conclusions just from 1 week.
Thank you. Thanks, David. Talk Erie, Joel, do you have a final question?
I do. This one's for you, ma'am. Is your administration hearing about any changes from the state coming in capacity limits, changing for restaurants or bars or the events?
Well, I think most people understand that the capacity limits just changed on Sunday. So we're only, 4 days into those capacity changes at this point. We also know that cases are rising to concerning levels in many parts of the state. Counties that were in a moderate level are now up to a much, I forget the next level up, what it's called right this minute, but substantial. So they've gone up to substantial, and luckily we've remained in the moderate level. So I do not imagine that the state will make any changes in the next few weeks until they, again, see what continues to happen with the vaccine, especially as it gets opened up to even more people, and to see what happens with these increased capacity levels. If a restaurant self-certifies now, they can go up to 75% of their capacity, still keeping the tables and the people 6 feet apart. And I know that's not always possible for a restaurant depending on their size, but there's a lot to learn from this expanded capacity before we look at increasing that.
Thanks.
Mm-hmm. And finally, we'll go back to Ethan at Erie News Now. Do you have a final question, Ethan?
I do. One for you here. Yesterday, we broke the story of the possibility of children being housed at the border coming to Erie County. Were that to happen, your thoughts on that just from a county leadership position and then also from a county health position, because it would also present some county health additional challenges?
Well, obviously, this is a challenge for the entire nation. And as a mother and a grandmother, I can't imagine these children, what they've been through. And obviously, I think it's the humane thing to do to try to find a way to take better care of them, to get them into better situations as quickly as possible. But I also know from a county perspective, there isn't any ask of us at this point, but that could definitely change down the line depending on what happens, how long they're here, what the needs are. So yes, we're definitely trying to stay in communication about this. We're keeping awareness around this and knowing that we may be asked to step up and assist in one way or another. We have no idea what that might be at this point. Okay. Well, thank you all very much. And I want to just mention another star business. It's actually another tattoo shop. Last week I mentioned No Regrets Tattoo in Edinburgh, and we have another tattoo shop out in Edinburgh, Game Over Tattoo, who's also making sure that they only take appointments and the door's locked. Temperatures taken of all staff and clients, and customers fill out a COVID waiver form to make sure they have no symptoms. They're not allowing clients to bring any guest with them. Masks are worn by all clients and employees, and there's plexiglass barriers at the checkout counter, and each artist's area is sectioned off to maintain social distancing. So I think one of the reasons that Erie County continues to do a bit better than the rest of the state and even some of the other surrounding counties is because our businesses continue to work so hard to keep our community safe. And so I cannot, again, thank them enough for what they've done. They've endured a lot over this past year. Please find ways to support our local businesses. And finally, I ask you to continue to wear your masks. It really is important that you wear your mask when you're out of your home and around people that you don't live with. Keep that 6-foot distance from others, whether you're vaccinated or not. And definitely, if you're feeling ill, limit your activities, stay home until you determine whether you have COVID-19 or something else. And I lastly encourage all to get your vaccine when it becomes available to you. So please do all you can this week to stay safe and to keep others safe in our community. Until next week, have a safe and healthy week. Thank you.